Hey guys, my name is Christina and I'm a doctor working in London. Choosing a specialty can be really stressful and overwhelming and complicated because there are so many options and it's such a big decision because you're gonna probably be working in this specialty for 30 plus years, so it's really gonna affect your life. So today I just wanted to give you some tips and advice on making the decision that's best for you. Tip number 1, get to know yourself. So before you make an important decision such as this one, it's really important to reflect. What are your skills, your strengths and your weaknesses? For example, decision making, critical thinking, leadership, teamwork, communication, problem solving. What are your values, goals and priorities? For example, helping people, personal growth, money, prestige, authenticity. What makes you feel accomplished? What do you enjoy? For example, looking for an answer, solution, seeing the effects of your actions quickly, making others feel listened to or feeling better, leading a team, being an expert, teaching others. What environment do you work best in? Do you prefer a slow environment or a fast-paced, more stressful environment? Do you prefer working as an individual or as part of a team? Do you prefer the atmosphere of the ward or ED or theaters or outpatients? What are your patient preferences? Do you prefer something generic or something more niche? Do you prefer treating a specific population? Do you prefer something more acute or do you prefer a more long-term kind of continuity of care with a specific patient? What do you want from life? What does success mean to you? Are you really focused on career and really ambitious? Would you prefer more of a better work-life balance? And is family really important for you or certain hobbies really important for you? So I think you can make the best decision for yourself without knowing yourself well first. So make sure you answer these questions for yourself in a really honest and genuine way before making the decision. So tip number 2, don't allow others to make the decision for you. So you will get a lot of advice and most of it will be well-meaning and genuine and valuable. But not all advice is created equal. So whenever someone's giving you advice, ask yourself, who is the person giving me advice? Is it someone you trust? Is it someone that has your best interest at heart? Is it someone that you admire, that has achieved what you someday hope to achieve, that shares your goals and your values? Also, what advice are you being given? You might not actually agree with this advice. This advice may also be outdated, so it might have been good for a different time and a different generation, but not for us at the minute. And it might also be biased. So a lot of people will try to convince you to do the specialty that they're doing. So don't choose a specialty based on others' preferences and values, because it might be the greatest specialty for them, but not really a good match for yourself. So some people might also feel pressure from their family or from society to do certain specialties. So for example, specialties where you can earn more money, or specialties that are more prestigious, or specialties that are seen as more competitive. But remember that you're the one that's going to be doing these specialties for years and years. You're the one that's going to be waking up at 3 a.m. to see that patient. So make sure that you make the decision for yourself and don't let others decide your future. Tip number 3, think of your life as a whole. So what do you actually want from life? Is family really important for you? Is work-life balance important? Do you really have hobbies that you really care about? Or other things that you want to achieve outside medicine? Do you want flexibility? Do you want to be able to travel? So how does this specialty fit into your life? Will it allow you to do the things that you want to do with your life? Tip number 4, think long term. So of course it's really important to have a look at the training pathway and what that will entail, but most of your working life is actually going to be spent as a consultant. So make sure you know what the day-to-day of a consultant is like. For example, it might be much more outpatient-based than trainees. Are you happy with that? You might have a lot more admin or management responsibilities. Also, what are the on-call duties? And do you think you'll be happy to continue this when you're in your 30s, 40s, 50s? It'll also be good to actually have a think about how this specialty is going to change or evolve in the future. Of course, it's impossible to predict, but are there certain advances that are happening, certain research directions? How is technology going to affect it? How is the change in the population going to affect it? So it's good to know what direction the specialty is heading and that you're happy with that direction. Tip number 5, be open-minded. A lot of people will go into medical school thinking that there's a specialty that they really want to do, but try to have an open mind. There's some specialties you might not even know exist. There's 60 specialties. Can you name them all? There's also some specialties that you might have had limited exposure to and that are not actually how you think they are. You may also be so fixated into this specialty and idea of what you're going to do that you're ignoring others that might be a better fit for you. So give different specialties a chance. Tip number 6, don't rush. This is an important decision that's going to affect a lot of your life, and as such, it needs time and thought and reflection. It's much better to take a bit longer but make the correct decision for yourself than make a decision quickly but incorrectly. Try not to compare yourself to others, especially if your colleagues seem like they've got everything figured out and they already know what specialty they want. Don't feel like you're behind. Training in the UK is really long, so it's much better to take a little bit more time before and be sure of your decision than going to training and then halfway through realize that actually you don't really like that specialty that much and have to go back to the beginning. If after 2 years still unsure of what specialty you want to do, it's really common and really good actually to take an F3 or an F4 and try it out a few different specialties to make your mind up. Tip number 7, research. So before committing to a specialty, make sure you actually know what the specialty entails. It's very different what a specialty looks like on paper than what it is in your day-to-day life. It'd be great if you could shadow someone that is doing that specialty or get a rotation in that specialty during F1 and F2. Talk to some juniors and some seniors about what the specialty is like, what they don't like about it, what their day-to-day is like, what kind of person do they think this specialty suits. Also learn about the possibilities after training in terms of subspecialties or tailoring that specialty to your interests. Doing research will allow you to make an informed decision. Tip number 8 is allow yourself to change your mind. So, as we go through medical school and we're exposed to different parts of medicine and different specialties, we might realize that what we thought we liked, we don't actually like, and what we thought we didn't like, we actually like. Also, as we grow, we will change as people, so our values, our goals, our priorities, our interests will also change, and that's normal. Most people will actually end up doing a specialty that's different to the one they thought they were going to do when they started medical school. So make sure you do re-evaluate your choices and don't fall for the sunk cost fallacy. Tip number 9, focus on the day-to-day. So don't be led astray by fascinating but really rare cases in a specialty. Try to also understand what the day-to-day will be like. What will be your daily jobs and responsibilities and role? What are the conditions that you're more likely to see and manage? Make sure you're actually happy with this day-to-day, because that's what you're going to spend most of your time doing. Tip number 10, don't base your decision only on one person or one place. It might be the case that you do a rotation in a specific hospital and in a specific department, and people there are so lovely, there's a really good teaching culture, there's a really good working environment, and you just love it. And you really enjoy your time there. But try and ask yourself, is what you enjoyed the actual specialty, or is it the people that were in that specific department or that specific hospital? Because in all likelihood, you will end up working in a different department and in a different hospital. And the people that were working there at the time will not be working in there in a few years. So try not to base your decisions solely on that. It's also quite common that we find a doctor that we really admire and we really look up to. We try mirroring their career choices. But again, try to ask yourself, is this actually the specialty you like, or is it just a doctor that you really admire and feel connected to? Tip number 11, don't believe stereotypes. We have all heard those stereotypes about the radiologist that never leaves a dark room, or the orthopedic surgeon that just is in the gym 24/7. But these stereotypes are not true. All different specialties will have all different kinds of doctors with their different personalities and ways of doing things. So if you're really interested in a specialty, don't let the stereotypes discourage you from pursuing this specialty. All specialties need all kinds of doctors. Tip number 12, don't give too much importance to money or prestige. So of course money is important, we all need it to survive, but don't compromise your happiness and enjoyment in your career for a paycheck. Choosing a specialty just for the money or the prestige, but actually not enjoying it is going to be horrible. Day in, day out, you're going to be doing something that you're not enjoying. You're not going to be fulfilled, you're not going to be happy, and you're really going to regret the decision later on. Also, I feel like in most specialties you can find a way to make extra money if you want to. Of course, some of them will be more prone to private practice, but there's always things that you can do. Or you can have like side hustles that are completely separate from medicine, but can also give you an extra bit of income. It's just not going to be good for you or your patient if you're doing something that you're not enjoying. Tip number 13, don't be discouraged by competition ratios. So some specialties look like they're more competitive than others, but the first thing to know is that competition ratios change. So every year it will be different. So it might be that a specialty is really competitive, when you're looking at applying, but actually the year that you apply is not as competitive. Also, don't be discouraged by them because someone has to get in. So back yourself and believe in yourself. Give it a try. Try to make your CV as good as possible. Have a look at the scoring system and the specialty websites. Get advice from other trainees and from consultants. Practice with them, and you will have a shot at getting in. So I hope these tips will help you choose the specialty that's the best for you. There's also a free resource in the description below with a checklist that will help you make up your mind, and also some reflection prompts to try and get you thinking of what might be best for you. Thank you.